Co-occurring mental health and substance use disorders is something that I've introduced previously, but what's really interesting about this is that if you want treatment for both conditions simultaneously at the same time, which is actually the gold standard because you're able to address both conditions at the same time instead of one or the other, what's interesting about the behavioral health services is that oftentimes mental health treatment and substance use/addiction treatment are often separated. So you'll have these organizations that only do mental health treatment, and you'll have organizations that only do addiction or substance use related treatment. This can be often a prominent barrier for folks needing treatment for both. Because if you have to go to facility A for mental health treatment and then facility B for addiction treatment, there's a prominent access, time, and logistical barrier that some people face when they're trying to access treatment for both conditions. So think, for example, if you need to go into an inpatient residential treatment program for addiction, and you also need to have your mental health condition treated as well, but you're only receiving substance use treatment in an inpatient setting, and then you have to leave that facility to then go to a mental health facility inpatient for their specific services. That's a major time barrier that some people just don't have. If you're looking for support for yourself or someone who you may know who has a mental health and substance use disorder, it's great to identify whether or not the facility or organization or whether or not that provider can treat both conditions simultaneously. Because if you're having one condition treated and not the other, that could be a prominent logistical barrier for you or your loved one, your friend, you name it. Because then after receiving services from, let's say, facility A, you may have to go to facility B for those mental health services. So this is something to keep in mind because, like I said, approximately 20 million adults in the United States have a co-occurring mental health and substance use disorder. And the gold standard is having these conditions treated simultaneously without having this gap of care and going from two separate facilities. And I will also note some facilities that only do mental health treatment and some facilities that only do addiction treatment may work together and have a memorandum of understanding and treat the same patients if that's indeed what that patient wants. So with that, I think I'll wrap up and I look forward to seeing you on the next one. Thank you so much for watching.